Thank you so much for joining me today, Chris and Anna. I've been noticing that most healthcare organizations are looking at two separate crises right now, a nursing shortage and an AI adoption problem. And they're treating them like two unrelated issues when they're not. They're very similar, conjoined problems. And I'd like for us to discuss that problem here today.
Looking forward to it, Tina. I think it's a great topic for conversation. And I think we have some ideas of ways to try to address this problem.
Perfect, perfect. So, since I do want to share this conversation with some other folks out there that may be facing similar issues, and we've had a lot of success in this area, can we just give some brief introductions? We'll start with you, Chris.
Thank you, Tina. Appreciate you having me on. So I'm Christopher Davis, and I have a PhD in adult learning. My background is about using data to make sure learning happens in organizations. So that's what I'll be here to contribute.
Perfect. And Anna?
Thanks, Tina. I'm delighted to be here. I am a nurse by training and education, although I haven't done any clinical work for a long time. I have been managing MPF Federal for the last few years as we work with our federal and commercial clients in addressing a variety of issues, but primarily focusing on healthcare and healthcare staffing and public health.
Gotcha. Thank you so much for that. And I'm Dr. Tina Flores. I do have a DBA, Doctor of Business Administration, and I oversee all things talent here at MPF Federal. So when we're talking about AI and nurses specifically resisting AI, what do you think they're actually resisting? Because when I look what's happening on units and hearing from those that I'm trying to hire, it sounds like the resistance is specific and it's logical.
So I would push back a little, Tina, that I don't know that nurses are resisting AI.
Mm,
They are more concerned about the risks that AI might provide to them. And I think if we can have a conversation with nurses and other healthcare providers as well about the value AI brings to their practice, to patient safety, to client safety, ways to save money, while freeing up the healthcare provider to provide better patient care, more efficient patient care, and more time with patients, then nurses will embrace AI. But there are some steps we have to take first to make sure that they understand and trust the AI tools that are being suggested, as well as how they can use them to the best of their ability to provide good quality nursing care.
understood. Now, Chris, from a learning perspective, how do you feel we can sort of close those gaps to provide more trust?
So just to absolutely echo what Anna said about value, that's something we see in the data, right? There's a lot of questions from professional staff of what value does this provide to me? And I think that is something we can directly address, directly answer. Once we get beyond the value proposition, we do find people who find the technology valuable. There's still a lot of friction. You have to take out a phone or you have to go to a computer. You have to find this application. You may have to ask a question. These are all things that people who are pressed for time, who have large caseloads, don't necessarily have ways to accomplish. So I'm very interested in new technologies. We're seeing the Google Glass emerge. We're seeing some onboard things that are a little bit easier to get access to, some ride-alongs that don't require an extra effort to engage with. And that's where I think you'll see practitioners making a bigger difference with AI when we lower that learning friction.
Gotcha.
If they can be more efficient and save time while doing their job, they'll embrace the tools that we give them. They'll embrace AI, but they have to trust the information that they're getting so that they can make better decisions. Not that AI is going to make a decision for them, but they're going to give them the information and the tools to make better decisions more efficiently and to improve the quality of care that they're providing.
Absolutely. So, what I'm hearing is that in some of these instances, nurses are actually protecting organizations from bad implementation that could negatively affect patient care. Now, to have good implementation, what do either of you feel would need to happen first?
Well, I'll make a couple of comments and then I'll turn it over to Dr. Davis, the expert. First is engage with the nurses early on. Ask them what they need, understand what they need, and then provide them the tools that they need. Don't come up with a tool and then you're going to present it to the workforce to say, this is the tool we're going to use. You really need to understand what the needs of the workforce are, and then what risk are these tools going to provide in any kind of way, and how you're going to manage those risks. Because in order for nurses to trust the tools that we give them, they need to know that they're reliable, they're transparent, they're easy to understand and use, and that patients will ultimately benefit from them.
So we just completed about a 6-month study on ROI from AI, looking at organizations that are actually able to demonstrate a return on investment. And that number is a lot smaller than I think people projected about a year ago. When you look at companies that have been successful, there's a 4-part framework that always comes through. And we're calling it the 4 requirements for a successful ROI on AI, because none of the companies we examined that were successfully doing ROI had omitted any of these 4 factors. And the 4 factors are access, leadership, training, and time. So access is getting the tools available, getting the ones to your people, removing the restrictions that keep them from being effective, right? Leadership support, visibility from the top, people saying you should use this in your job. We encourage you to use this in your job, and here's some support we can give you to use this in your job. Training, specifically exactly what it's talking about, gaining that confidence with the tool to be able to use that tool on the day-to-day basis in a way that moves your job responsibilities forward. And then time. It takes about 6 to 9 months from the time when someone first opens an LLM or an NLP model window and asks a question to ChatGPT until they're actually able to use it at their job in a way that generates business ROI. So access, leadership support, training, time.
Perfect. Now, from a recruitment standpoint, when I'm looking at some of these nursing candidates and looking at the things that they're going to be doing, and some of these organizations are already knee deep in AI, I look at their tech savviness, their tech readiness, and their openness. How do you feel that from a recruiting standpoint, we can really identify those that are ready to adopt AI, those that are confident enough to at least be open to it?
So let me start on that one. Openness to experience is a well-researched psychological trait, right? We can map this. We've been mapping this for 50 years. And it's a personality construct that fits, like most personality constructs, along a continuum from highly negative to highly positive. Dr. Flores, I want to ask you a question, and that's about the recruitment of AI-ready nurses and AI-ready healthcare personnel. What are you looking for, and how do you look for it?
So AI ready, what a construct, right? So when doing this, I need to evaluate not only their ability to use, but their openness to engage in use if they're not already doing it. Most nurses that I come across are excellent healthcare providers. They are providing the top patient care. So AI isn't necessarily top of mind. But what we do on our team is we definitely ask those questions of utilization, openness, maybe not at work, but are they articulating that they've been able to use these personally? If they have professional use, great. When they are using AI, how are they using it? Then we have some behavioral questions that in these circumstances, if you had to use AI to produce a summary, what would your next steps be? This way, we're able to then understand how they would use it. Are they just copying and pasting?
I think that as AI continues to develop and people are realizing that this is here, this is not going to go away. And so we really need to understand it, embrace it, and use it to the best of our ability while putting parameters around it that make sense, that there are standards around it that make sense. HIPAA violations are something that nurses are always worried about. So I really look at associations and nursing leaders and healthcare leaders coming up with standards and metrics for ethical use of these tools. And nurses really need the guidance because, frankly, the regulations caught up with AI and how we use it. And, if there's an error, how Is it managed? Who's responsible? So there's still some of that concern in the nursing environment. But I think as we think about this more and we count on nursing organizations to establish standards and guidelines for use by the profession, that's the best role they can play.
So AI readiness in a clinical nurse is actually three things to us in the recruitment team. Calibrated trust. So that's the ability to use AI output as one data point, not a verdict. So this nurse asks, does this recommendation match what I'm observing before actually acting? So there's no firm reliance on the AI. Another thing is ambiguity tolerance, the ability to function effectively when the AI isn't really giving a strong answer, gives an incorrect answer that they know is incorrect from their nursing practice, or it conflicts with another source. These nurses that are ready to not only take that answer and be like, let me do some more research. And then there's number three, adaptive judgment, the ability to modify behavior as the tool changes. So AI systems update rules, policies, guidelines change for these nurses all the time. So when they are able to take the information that they have and use their nursing judgment to then be able to use the tool, put it into action effectively for the best patient outcome, those are all things that my team needs to hear during the interviews. We ask behavioral questions. We do center some of this on actual things that they've done in the past that we want to hear real stories. And all of those things come together to paint a holistic picture of these nurses and their ability to be AI ready. So as we kind of talk more about this, there's a lot of ideas out there, a lot of thought leadership as it pertains to AI overall. For each of your specific domains, what do you feel is the biggest misconception as it pertains to nurses and their AI adoption? Anna, I'll let you go first.
One of the things I think is the concern that AI is somehow going to replace nurses, and that's not going to happen. AI is going to be that tool that will help nurses make better decisions and cut down on their workload. Documentation, medication errors, there's a lot of things that AI tools can assist nurses in making better decisions. And nurses at times will be concerned that somehow the AI is going to override and make the decision when their clinical judgment is the best thing possible to use to make good decisions. So the tool needs to support clinical judgment, not replace it.
Perfect. Chris?
From my perspective, when I'm looking at learning organizations and the learning wings of organizations, the biggest misconception is that access alone will lead to utility. When somebody buys a tool and sends out an email, we see less than 10% of an organization pick up that tool. When they provide training, you can maybe bump that number up to 15%. But really, to get a big shift in organizational practice, it takes a lot more. It takes time, it takes leadership support, and you're going to need to match that access with, you're going to need to match that access to the tool with a useful way for people to use that in their day-to-day operations. That's what will bump up the number of people at your organizations actually adopting your AI metric.
Gotcha. And one of the things that I'm noticing is that there's a lot of talk about a hiring quality problem. I don't think that that's the full issue. I think that we've put a lot of energy and a lot of effort for speed and cost, which are both important, don't get me wrong. But I think that we really want to look at the quality of the nurse that's coming on. When we're looking at AI, if we look at AI alone, or we look at the qualifications or how fast we can hire alone, that doesn't tell us if they're going to be there in 90 days. That doesn't tell us if they're going to be able to adapt and overcome to all of the changes technologically that we're facing over the next couple of years. So I think that looking at these nurses holistically and their ability to adapt, change, move with the tides, I think that that is an important distinction when looking at hiring quality as well.
So I'd like to follow up on that, Tina. Your field right now is facing a sea change, right? We've all heard about AI generated resumes. There's AI helpful interview tools, even AI face masking that will in real time change your face to appear a different way during an interview. What's your take on candidates that are going to be in the healthcare profession using those tools, and how do you make sure that someone really has the skills they need?
Well, it's scary if someone in healthcare is trying to fraudulently apply like that, because these are people that we are trusting with lives out there. So absolutely not. That is a zero tolerance. We have a very human-centered way of looking at these candidates and really understanding that they have the skills. So the face masking, the AI resumes, we can use technology to counter technology, some of those things. We do have a specialized system in place to counteract those. So that's not even as big of a problem. But when we have people that are AIing their answers and trying to come up with the best response, the only thing that we have as a recourse as a recruitment team is to out-human the AI. So we ask behavioral questions. Not only tell me about a time, we ask questions that really get down to the skill of it. Do they have the skills? And we ask our questions in a way that really provokes a skilled answer. So there's a lot of basic questions that people can chat GPT. They can have all kinds of applications to provide them the answers. But I definitely pride myself on the work that my team's doing to ask questions in a way that evokes a technical response from these nurses. So we know with a very high level of certainty that they can do and have done the things that they say they can.
I think that's a problem that's confronting organizations across all sectors at this moment. So that recruitment team that's proactive, being aware of the tools that are out there, that awareness is to me something that grants confidence from the C-suite, right? If we can believe that our recruitment team is aware of what's happening, is screening for it actively, and is using behavioral driven method to make sure that the people we're hiring have the skills they need, that's what gives me confidence.
Absolutely. Absolutely. So when looking at moving forward, right, we've kind of discussed potential reluctance or the absence thereof. We've discussed a little bit of recruitment, some of the learning curves. What would you say is next for nurses?
So I think you need to understand what the needs of the nurses are. And from the C-suite point of view, that can look very differently. What the nurses in ICU need are very different than the nurses that are working in a call center. And so doing a very strategic assessment of what the needs are of people and matching those needs to the right tools, and then providing the training to use those tools afterwards are very, very important. There also has to be a return on investment of the work that the nurses are doing, the upfront implementation costs of those different tools, and then a very concrete metric for evaluating whether you've had a good return on your investment or not. And then the other thing that I don't think we should forget is checking in with our clients and our patients. How do they feel when they are engaged with a provider who is using AI? And this is kind of a story I'd like to tell, if there are people who are constantly talking to the computer and not talking to the patient, that's not going to go over well. The best AI tools are those that the provider can use to evaluate lab results, evaluate different ways to chart, to document what's going on, to provide a plan of care. But talking with the patient one-on-one, that direct contact, eye contact with the patient is absolutely critical. So thinking about all of those things when you're making a plan on how to implement this in the workplace is critical. Who's going to use it? Who's the end user and how are they going to react to it? As a company, what are you willing to invest in the tool development, the assessment, and the training? And then how are you going to measure it when it's done?
I definitely am going to echo some of what Anna said in my response. So my apologies for the redundancy, but I have to agree with a lot of the things there. Tina, you started out this conversation with this idea of staffing shortages. And from a metric standpoint, from an analytics standpoint, I want to know how that happens. Well, we do know how that happens, right? Annual RN turnover sits around 20%. That's 1 in 5. First year nurse turnover, 1 in 3, right? So we're paying all this money to train these nurses. It's very hard to get slots in nursing programs. Then they leave the field. This then, in turn, stresses the current system and makes people have to cover extra shifts, do extra work, cover more floor time, have larger caseloads. That leads to stress in them. That leads to their attrition. And this cycle continues. To me, if AI can help us break that cycle, that's the win. Can you imagine a world where the nurses aren't stressed and overworked? Like, it shouldn't seem that unrealistic, but that seems almost a crazy vision. If you speak to nurse educators, all of them will tell you that they students constantly about the demanding aspects of this profession. I don't think that's the best way for our nurses to perform. And I want to help our nurses perform at the top of their capabilities. That means giving them their time back with trustworthy assists that let them be nurses with reasonable caseloads, with reasonable patient times, and breaks that continuous cycle of train attrition, train attrition. And I want to get us away from that using technologies that help nurses in their day-to-day business.
Very well
Gotcha.
said, Christopher.
Perfect. Now, let's be a little controversial here. That all being said, great points from both of you. Do you feel that AI is making healthcare organizations better at developing confident nurses? Or do you think it's giving them permission to underinvest in human development? Anna?
Tina, that's a great question. And I think it's very specific to the system that's implementing the AI. Some are doing it to support the nurses and help them to be more efficient. And everyone, it's actually a very good question because that's what nurses want to know. Are you doing this to help me? Or are you doing this to get rid of me or
Yeah.
reduce the number of me that are around? I mean, that's a real fear, but it is very specific to the system. So it depends is the answer. But I think short-sighted people or short-sighted systems are the ones that are trying to do it as a way to reduce staffing levels or reduce the qualifications of the staff when it's really important and in the best business interests of systems to support and provide those tools to nurses so they can be better at their jobs, not to replace them with a tool.
We need to really be considerate about where AI fits in training programs as a tool versus a tool that we use on the floor to help develop or to help augment our own practice. So I think that distinction is one that systems need to take great care in.
The other thing that I like to think about too is a lot of what nurses do is around prevention, preventing people from getting sick, preventing people falling in hospitals, preventing medication errors, preventing decubitus ulcer. There's a lot of things that we do that are all about prevention. And the more that we can provide assistance to nurses to help evaluate data and patient information that allows them to do better prevention, the better off the nurses are going to be and the better off patient care is going to be.
Something that they can grow into that definitely makes them a little bit more trustworthy of the nurses, especially the things that I've seen on the projects we've worked on internally.
So this is a really key point too, because a nurse doesn't take a job. A nurse joins a system, right? And that system may be a small one, maybe a very large one, maybe focused on a certain type of patient, maybe focused on a certain type of care. And those decisions matter a lot. Early in the nurse's career, they may trickle down for many, many, many years based on those early experiences, right? So in the case where we're able to keep a nurse in the field for many years, we want to be really conscientious of those early experiences, not just with technology or immediate peers, but with the larger system of supports, right? And there are things that an individual is not going to have an ability to control. That's going to be your policies, your statutes, your judicial opinions that come down, or system level rules, what your hospital chain says you can and can't do, the levers that come down in policy at your organization. and even supervisory trends, right? So there's an alignment problem that happens when you have any systematic change. But with this disruption that we're seeing in AI, I encourage organizations to think about the whole system the nurse interacts with, not just that one-to-one patient experience. That's both going to show you opportunities to use AI in new and novel ways to reduce friction, give people more time back, as well as create a better experience for your employee, hopefully fighting those attrition patterns in the future.
Chris, that is a great point, because whatever we can do to make the nurses' work environment easier to get a job done, the better off everyone's going to be. And having that kind of philosophy up front when you're implementing a new program is going to make the adoption by the nurses so much easier.
I actually have a perfect story. I was talking with an organization the other day, and they're doing some really cool stuff to get their new nurses acclimated when they switch floors. So they have an AI chatbot that they've installed into their system that allows them to ask floor-specific questions. They're able to use this as a resource, as a tool to gain that confidence needed to be able to provide better patient care. Now, I'm not talking like, how do I clean a trach? They should probably know that. But things that are floor specific that happen on this floor. What are the policies? What are the procedures? What are the routine things that happen? If they've never had to use this specific tool to do this procedure, this system helps them acclimate to that in real time. They're able to use regular questions just as they would talking to somebody that's an expert. So it's their little SME in a box on the computer that helps these nurses get that confidence, provide excellent patient care in record time. So I've seen that as a real AI win.
Love it.
I think there's a lot of AI tools that management can use that really benefit the work environment of nurses around scheduling, predicting patient volume. I've seen that where we know in the fall it's going to be flu season. So you need to adjust your staffing pattern for influx of patients that may be coming in, or in the emergency room, Saturday night's a little different than Thursday night. So there's a variety of things that some of these AI tools can do to predict patient volume, to help optimize staffing levels and assignments so that you can match the right nurse with the correct nursing experience that the nurses have with the patient's needs. And then managing bed availability. When I was working as a nurse years ago, that was a major problem for nurses, where you had discharges and admissions on your unit during the middle of a shift, and you had to do a lot of rearranging of beds and doing a lot of bed management. And thank goodness some of these tools can really take that burden off the individual nurse or nurses and come up with a better automation solution.
Perfect. Now, Chris, you work with a lot of data that helps provide answers and moves action from leadership teams. What would you say are the most interesting data points that lead to AI success?
All right. So when we look at someone's journey in using AI and becoming a power user for the purposes of driving business ROI with AI, I mentioned earlier there's about a 6 to 9 month time period. And there are several key steps that happen along that way. The first one's just access. Do they open the tool and do they use it? Because before they do that, they've received a lot of messages about AI. Some are positive, some are negative, many are neutral. But those messages will then lead to their development of an AI affect, either negatively coded or positively coded. Your leadership can influence those messages, and they can drive that first access. And we know we have good data that shows that people who interact early on with a positive affect are more likely to continuously progress down an AI learning pathway. The second step after they've started interacting with the tool is to start uploading files to it. This is something in healthcare we have to be very cautious of. And often that caution is thrown out as such a scary way that many people in the healthcare profession never make it to step 2 on the learning journey. That means that, steps 5, 6, and 7, where you're doing cool things like moving agents around or coding your own applications, will never happen because they didn't make it past the uploader step at step 2. So I think controlling the messaging is something that we're seeing show up in data. We're seeing it show up in organizations that have had successful ROI, and something that you can do right now. You can do today. You can think about how you're going to positively message to your staff that this is going to be a tool that assists you in your job. I echo another point earlier from our conversation of, well, if we're going to control the messaging, what does our audience want to hear? And I want to tell you that your audience's biggest fear is job replacement, almost across sector. Nurses are actually one of those jobs that are pretty insulated from an AI compared to some other professions. But there's still a lot of anxiety about job replacement. So be open, be direct, tell them this isn't going to replace them, and tell them that we want to see you using it, and tell us your success stories. Then share those out. We've found some really cool, really positive, impactful practices where the organization has learned from its practitioners on the ground. So if you're listening to your nurses and they're telling you a way that they used AI in a positive, disruptive manner that helped them be a better patient caregiver, helped them manage their shift with less stress, helped them achieve more objectives in a given amount of time, internalize that story and see what you can do to distribute it outward. Your own people will give you way better use cases than an external consultant ever could.
Absolutely.
Yeah, nurses can be the best advocate for this with other nurses.
Absolutely. And one thing I'll add to that is during recruitment, you hear a lot, right? We hear everything as it pertains to who they are, what they want, what their career trajectory is ideally, and all of those data points. We shouldn't be ending that recruitment data at the offer. Things they said they could do, things they said that they're excited about. We should be holding on to that information. So if I'm talking to folks that are super, yes, steam powered for that AI stuff, let's flag that and watch how that journey unravels throughout their time there. Because we might have this advocate that's willing to come in, implement stuff, use it, speak for it, share it with their friends, and get people bought in. And we're already starting to avoid burnout. We're starting to avoid confusion. We're gaining that confidence because we listen to these people and we're able to use that recruitment knowledge beyond the offer point.
One of the best ways to use AI is to help in documentation. Nurses spend 3 hours or more in a shift trying to do documentation, whether it's end of shift summaries or interactions with patients. So AI tools can dramatically reduce the amount of time nurses put into documentation so that they can spend that time providing care. Automation of charting, summarizing notes, meeting schedules, analyzing data, lab results, all of those things can truly be enhanced by good AI tools.
100%. There's actually a 6 health system study, the JAMA Network Open. It did a study of about like 260 or so physicians and advanced practice practitioners that found that within 30 days of using an ambient AI scribe, their burnout rate went down about 13 points. 30 days, 13 points. So that means that being able to reduce that documentation load, that mental load of the things that they're doing that's not people facing, they were able to have that much of a significant reduction in stress. 30 days.
That's great. And I don't doubt it a bit. And I would also say that the opportunity to use AI tools when you're doing communication with patients, like discharge instructions that you're sending home with the patient, explaining their plan of care after discharge, a lot of these kinds of things can also be enhanced by using a good AI tool.
Absolutely. Absolutely.
So helping develop those strategic plans, evaluating the implementation of those plans, doing metrics and evaluations of patient outcomes, staff satisfaction. These are all things that can be done with a system to help ensure that you're implementing your AI toolkit properly and in the most efficient way possible.
I
Yeah.
would encourage people who are trying to do an AI implementation to think beyond the tool. One of the biggest errors I see is in AI acquisition run like you would pick any other software. We compare the abilities of the software and pick the one that seems to fit most with our IT profile. That's not showing up in the data as a successful implementation strategy. You need to have human-centered designers here looking at workflows, looking at pain points, and looking to see what we really want to use this tool for instead of the attributes of the tool itself. Companies and organizations that are able to do that are seeing much higher adoption rates when they buy that AI tool. They're seeing much higher success reports from their people using that tool, and they're seeing actual return on investment from that money they spent. So that's one thing I would encourage is don't treat this like a software acquisition. Treat this like a human problem because we want to help the people on the job do their work better, more efficiently with more support, not simply burden them with another tool, another documentation plan, another system that they need to log into.
Absolutely. Absolutely. And that definitely speaks to the recruitment aspect as well. We always have to be better, faster, stronger. Time to fill remains one of the biggest metrics that recruiters are held to. And to get to that point, using AI on our side to really go through the resumes, to have these positions posted, to automate some of the correspondence that's going out so that we have that much more volume of touch points, implementing AI into our processes, not simply using it, not just having it on board and it's sitting over there looking pretty, but really utilizing it to its maximum capacity has really shown my recruitment team what speed is really about without sacrificing the quality of nurses that we're hiring, because we're hiring hundreds of them and really good ones, if I do say so myself. So I've seen it the most successful and providing the greatest level of ROI when it is brought on and implemented as a system. It's being put in, it's being used, it's being maximized.
This has been a great starting point for this dialogue and conversation, and it's such an important topic for so many people. But I think we're just starting the conversation. And so those of us at MPF that are really spending a lot of time and thought on this, we'd like to engage with other people. So we'd like to invite you to join us for other conversations about this topic and maybe others, where we can talk about how we can work together to address the nursing shortage and the AI challenges that we're all facing.
Absolutely. So if you're interested in connecting with this, in the description, we do have our email address available, and you can reach out to us at any time.
I think it's great to hear the stories on the ground. What you were telling us about the JAMA study, what Anna was sharing about documentation, that there are organizations who are getting this right now. And your organization can be one of those.
I really appreciated what Christopher said about the steps that employers and systems are taking to really implement this properly and are having success. And so I think the more that we can talk about those successes and get that information out, let's learn from what other people are doing and doing right.
Absolutely. And speaking of learning from people, one of the things that you've said throughout this conversation is listen to the nurses. And I think that that's extremely important, not only from an organizational standpoint, but as a recruitment professional, listening to these people, understanding what their needs are so that we can best inform these organizations. That's only going to lead to astronomical success.
I agree with you. You must listen to nurses. They always know the best.
So one takeaway
Perfect.
for me is the consistent thread here that the humans have to be the center of the process. So you sort
We
of hear
haven't
this
said that.
phrase, human in the loop. But it's more than that. It's designing with humans in mind from the start of your AI adoption. Whatever your focus group is, whatever your process you're using to go out and acquire the technology, put the people first. That's how you'll get to organizational success.